Just because you are over 60 or more than 10 years postmenopause does not automatically disqualify you from using hormone replacement therapy. It just means that you got to get clear on the risks and benefits and make a decision that's right for you. And in particular, what I'm talking about is the cardiovascular risk. We have a couple of studies that were done on women who started after 60 or more than 10 years postmenopause that did show an increased risk of cardiovascular events, largely thought to be because of more blood clotting, especially in the first year of initiation. And that blood clotting risk did go down. That is a risk. It doesn't mean that just because you use the hormones, it's a guarantee that that would happen. It's just that some women will react that way. And the other challenge with these studies is that they're largely done in women who are taking oral estrogens with synthetic progestins. And we have more studies today done on transdermal estradiol that show no increased risk of blood clotting in a general sense. So you might be able to decrease your risk of this, window, this 1 year window of if you're more than 60, more than 10 years postmenopause, reducing that risk by one, having low cardiovascular risk to start with and being relatively healthy. Two, starting on a lower dose of transdermal estradiol, especially in that first 1 year window. And then we see in the studies that risk decreases after that first year. So you might be good to go after that. You just have to be more clear that there is some type of risk. So you're going to have to be a little bit more comfortable with some unknowns, that we can't make as many clear, absolute recommendations like we can when somebody is younger than 60 and less than 10 years postmenopause, where the studies are very clear that we reduce cardiovascular events. We do that by reducing plaque production in the arteries through a whole bunch of different mechanisms, including metabolic factors like LDL, blood sugars, inflammation, a whole host of things. So when we're talking about starting hormones in the sweet spot, in that ideal range, it just means you don't have to take into account the cardiovascular risk because you're getting cardiovascular benefit, versus there have been studies that have shown some increased risk of a cardiovascular event in older women. And another thing is, it's not like you get to be 60 and then all of a sudden your risk skyrockets. It's not like if you started at 60 and a half or 61 or 62 and you're a relatively healthy person with relatively low cardiovascular risk, it's not an absolute day or minute that all of a sudden that risk changes. So you just have to talk with your provider and be clear as to whether or not it's something that you want to try. And if your provider is saying absolute no, that is a misconception. You might need to find yourself a different provider who is a little bit more willing to respect your autonomy and decision making for your own individual body. So good luck. Hope this clarifies some misconceptions around that ideal age range for you.